Do you have a group chat that you turn to whenever you need them? It's incredible that we can tap into our support system at any moment and can lean on our friends and family in our time of need. The modern ease of connection has allowed therapists to evolve telehealth to include asynchronous group therapy, aka group chat therapy. What if teens ages 13 and up could be enrolled by a school psychiatrist into a group chat hosted by 2 or 3 clinicians? Hi, my name is Cheyenne. After 7 years of teaching in high schools across America, I used my experience to found Peoplin, an independent research hub sharing evidence-based goals and resources covering everything from childhood experiences to disaster readiness. Being a part of this community means you don't have to start from scratch. Just pick the goal that resonates with you. Peoplin is a research hub grounded by 9 pillars, and this video explores actions aligned to pillar number 5, foster community. Building community, reducing feelings of isolation, and alternative perspectives are 3 benefits of group therapy mentioned on the U.S. Department of Health and Human Services telehealth page. A 2024 study specifically evaluating a virtual group therapy program for adolescents found participants had significantly lower readmission rates within 6 months of discharge from inpatient care. The virtual format also helped address healthcare disparities, as teens with public insurance or those from primarily Spanish-speaking households were equally likely to attend. That said, a 2023 systematic review found mixed results for online peer-to-peer support for young people. Some studies showed positive outcomes, others showed no effect, and the overall quality of research was considered limited. What seems to matter most isn't whether the group therapy is delivered virtually, but how it's designed. That's why the HHS site shows considerations to use when providing teletherapy, including pre-screening members, enforcing a strategic group size, engagement, and developing group guidelines to cover what's acceptable and what's not. Since these group chats are facilitated by professionals, it's important that it's hosted on a HIPAA-compliant chat for privacy and safety of the enrolled participants. Standard messaging apps won't cut it. A quick search of HIPAA-compliant chats will show various results that can fit different situations, institutions, budgets, needs, and capabilities. Experts construct the chat, but rubrics can help communicate participants' healing progress, as well as facilitators' motives behind decisions and additions and removals of chat members to school leaders, families, and students. Even if staffing is limited, it's important that group chats are hosted by at least 2 facilitators. The mandate that non-family adults never be left alone with a child is a core pillar of institutional abuse prevention and risk management. I remember receiving training on this every summer I hosted those 2-week coding boot camps. Whether we were hosting a camp in person or virtually, we absolutely could not be alone with a student. If for any reason we could not have a second teammate available, we had to be in a public or recorded space. The 2-adult rule eliminates opportunities for abuse and also helps adjust perspective in case messages are misinterpreted or taken the wrong way. What do you think of group chat teletherapy? Do you know of any teletherapy organizations that specialize in this form of support? Leave a comment below so we can share and spread awareness. Don't forget to join the Peoplin community. This research initiative is independent and funded by people like you who believe communities should be built on evidence. Starting as little as $2 a month, you can fund an hour of free research that actually helps kids and communities here in America. These resources have no paywalls, just evidence. Your spot on our wall of gratitude is waiting, with special icons for our early supporters. Thanks for building this with me.